I've got 1 year to live without a liver transplant. So the liver transplant is the treatment that I require. It can take between 6 to 12 months to actually obtain a new liver from the NHS organ donor register. So obviously time is ticking. You don't know when the phone call's going to come. You just live day by day hoping that you're going to get that gift of life, that call from the hospital. It's very difficult, and you sometimes you do feel desperate.
Carol Beckett has liver cancer. If she doesn't get a transplant soon, she will die. She's one of nearly 10,000 people on the organ donation waiting list. Every year, 1,000 people die waiting for a transplant. That's roughly 3 a day.
It's just not good enough. We need to start looking at ways to save these people's lives, because, it's unnecessary deaths. If it was your mother, sister, brother or grandfather, what would you want? You would want them to live.
The situation is getting so bad that support is growing for a dramatic change to the whole donor system. At the moment, organs are only taken if a dead person carried a donor card or with the consent of their family. But radical plans would change that system to one of presumed consent, where doctors can assume organs can be used unless a person opts out or their family refuse.
I think opt-out on its own wouldn't work. I think you need to have a sort of mechanism in place, which is included in the new plan that's coming out tomorrow, of implementing transplant coordinators in all the hospitals.
An expert report to be published tomorrow will recommend that every major hospital has an organ donor specialist skilled in persuading grieving families that the vital organs of their loved ones should be used to save the lives of others.
In the case of Spain, which is the best performing country in Europe, they had the opt-out system for 10 years, and it was only when they got transplant coordinators in place at the end of the 10-year period that the actual organ retrieval rates increased.
It's not quite certain yet how the current system will change, but it's clear something needs to be done to end the shortage of donors. David Henry, Channel M News.